Will psychological therapies be of benefit in conditions like long COVID or chronic fatigue or ME? It's a very controversial topic, and there's been a lot of problems with how these techniques have been offered for our patients over the years. Now, I think I need to be at the outset very clear in saying we need to be sure of what it is that we are trying to achieve with psychological techniques. There's been a lot of problems that has been caused due to certain scientific studies. For example, there was this study called the PACE trial, which looked at offering psychological techniques as the mainstay of conditions like CFS and ME in the past. And that has been a big problem because we have now realized that there are some methodological flaws in that study. The study did have its challenges in how it was done and how the results have been interpreted and presented. And unfortunately, for a period of time, the guidelines did indicate that psychological techniques are the main and the first line approach for conditions like CFS and ME. And this has been really subjected to vigorous pushback from patients who've been struggling, who really said that that's not what they want, that's not how they wish to be validated. And with the arrival of a condition like long COVID, we've realized that there is a lot more happening in these conditions that we need to be aware of. So there is now a better understanding of where psychological techniques fit in the management for long COVID or CFS or ME. And right now, at this time of recording this video in 2024, this is what we understand about psychological techniques. In many of these conditions, first of all, there are changes that are happening, for example, to the energy factories in the cell, the mitochondria. There are changes that are happening in the immune system. There are changes that are happening to the overall nervous system and how the signaling is happening between various parts of the brain. There are changes that are happening in the gut in how the microbiome is changed in all this. So these are all fundamentally biological, if you will, changes that are happening in various parts of the organs and the organ systems, including the blood flow and the circulation, that are affecting various parts of the body, causing a number of symptoms that we see in our CFS and ME patients. But this is not to say that these same kind of low-grade immune and nervous system changes could also happen in the circuits of the brain that are mediating emotion and mood. There's no doubt that things like anxiety and depression are coming from changes in the neural circuits that are around your emotional centers, which are called the amygdala, that are around your memory centers called the hippocampus, and then the more emotional circuitry called the limbic system. These are all very deeply involved in processing mood and emotion and leading to mental health states that we recognize as anxiety or depression. So it's very possible that in conditions like long COVID or ME, the same kind of neuroimmune disturbance or change that has happened in other parts of the body could also be happening in these zones that are processing usually mood and emotion, and that can alter the circuits here, and that can present as new onset anxiety or depression. And in those situations, techniques like CBT, that is cognitive behavioral therapy, techniques like acceptance and commitment therapy can make a difference as psychological techniques that can be used for managing these patients. And that's what we've understood over time, is that for conditions like CFS and long COVID, it is the judicious, it is the careful application of psychological techniques for supporting the ups and downs in mood and emotion that occur as part of the condition. It should not be considered as the first line approach for these conditions, but it is definitely going to help as a part of an integrated approach, I think psychological support with the use of these two techniques. And there are some other techniques that are being actively looked at. For example, emotional awareness and expression therapy has been looked at there. There are a few fatigue specific kind of techniques that are being looked at. But by and large, the best evidence has been for CBT and ACT, with some further developments on this type of techniques, what's called the second wave and third wave of psychological techniques. For some patients, you might need a little bit more intensive psychotherapy or psychodynamic approaches as well, and that will depend on the specialist you consult with and get the support from those groups of people. I hope this allows you and helps clarify the role of psychological therapies in conditions like long COVID and chronic fatigue. I hope you found this video useful, and I'll see you in the next one. Thank you. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.